Greetings and welcome to today's presentation titled, Meeting the Kids Where They Are, How the Education Sector Implements School Behavioral Health Systems. Before we begin, we would like to mention that this is a safe and friendly space for positivity and productivity. There are a few housekeeping items I'd like to quickly go over. This presentation is being recorded, and the recording link, slides, and a letter of attendance will be sent via email to everyone who attended today. This information will also be available on ASTHO, and NASHBID websites and NASHBID's YouTube channel. Please use the chat pod to share your name and state, ask and or share any information with the group that pertains to this presentation. Closed captioning can be viewed by clicking the CC at the bottom of your screen or clicking the link in the chat pod to view in a separate window. We also have an ASL interpreter who is spotlit on everyone's screen. After the presentation ends and you leave this platform, a brief survey will show in your browser. Please take a few moments to complete that for us and share your comments about today's presentation. We would like to give special thanks to SAMHSA for sponsoring this series, and thank you again for joining us. I will now turn this over to Ioana from ASTHO to share a few things with you. Thank you.
Thank you all so much for joining us today. This webinar is sponsored by SAMHSA, and it's a partnership between the Association of State and Territorial Health Officials, as well as the National Alliance on Mental Illness. It's part of a 4-part webinar series. As we all know, the youth mental health crisis is complex and it requires a lot of sectors to work together collectively. So we've already hosted one session for which we can share the recording for around the role of public health. And this one is focused more on the education sector with that linkage into public health and other sectors. And then we'll have 2 more around pediatrics as well as the nonprofit sector. Next slide. Just a quick disclaimer, as we've mentioned, this is SAMHSA funded, but the views, policies, and opinions expressed are those of the authors and do not necessarily reflect those of SAMHSA or HHS. Next slide. ASTHO's vision is to support state and territorial health agencies in advancing health equity and optimal health for all. And like I mentioned, this is co-sponsored with NAMI, and we're so excited for our partnership together. Next slide. We have great presenters for you today. Our partner, Sharon Hoover at the National Center for School Mental Health, has wonderful expertise in this area and can share how cross sectors can really work together to implement and improve school mental health. And then we have a state example from you all from North Carolina, and we'll have the North Carolina Department of Public Instruction, as well as the North Carolina Department of Health and Human Services. Next slide. Our goals or objectives for this session is to increase knowledge about the role of education in addressing children and adolescent mental health, including those experiencing serious emotional disturbances, and of course, to learn from a state example about the importance of cross-sector collaborations for comprehensive youth mental health systems. And without further ado, I am going to turn it over to our first speaker, Dr. Sharon Hoover. Thank you so much.
Thank you so much, Ioana, and thank you so much for hosting me for this webinar. I'm really thrilled to see that education and schools are a part of how you see systems of care and support for young people. And before I begin, I am going to go ahead and share several links in the chat. I'm going to be referencing some resources as I go along today, so I want you to have those at your fingertips. And I'm also delighted to be joined by our partners in North Carolina who've been doing innovative, excellent work in this space. And I know for our state level leads, it's really important to hear from your other state level partners in this work. So I'm going to give a bit of the 30,000 foot view along with some resources that we have brought to the field and that our partners have brought to the field to advance school mental health systems. And then you'll hear the nuts and bolts of how it's actually happening in North Carolina. So you see here, I am privileged to serve as a co-director for the National Center for School Mental Health and the director for the National Center for Safe Supportive Schools. Both are are federally funded. The first center you see here is funded out of the Health Resources and Services Administration, and the second center, the NCS3, is actually part of the National Child Traumatic Stress Network funded by SAMHSA. And for the last 20 years or so, I've been working in the space of school mental health. I'm a clinical psychologist who worked in Baltimore City schools for a number of years. Our national center, on the next slide, you can see, has been around actually since 1995. And our mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. We are housed at the University of Maryland School of Medicine, and you can find out a little bit more about what we do at schoolmentalhealth.org. But in a nutshell, we are in the areas of policy, research, training, technical assistance, and practice in school mental health. So we really sit at that intersection of education and behavioral health. And I did so as a clinician in the schools and realized that we have to be in schools. I initially was working in outpatient, inpatient, pediatric hospitals, and then started working in schools and realized how essential they are, not only as a point of access for mental health services for young people, but also as we're thinking about that full continuum of mental health promotion all the way to intervention or treatment. Schools are where it's at. It's really important that we have schools as a part of this conversation. So I'm grateful to NAMI and to ASTHO and SAMHSA for really engaging schools in this way. So on the next slide, you can see a resource that our center put out to the field in partnership with many folks from the field at federal, national, state, and local levels, really as kind of a guidance document. So the what, the why, the how of school mental health. So I imagine many of you have been in the space of school mental health for a while. Many states have their own frameworks. Many communities are embracing school mental health and have been doing this work for a while. But if you are just coming to this space, or if you have others that you're really looking to kind of get up to speed on what, why, how of school mental health, this is a good starting point. It is it's digestible, I would say. It's about 15 to 20 pages, and it addresses the things you see here, including some local and state spotlights of how to do this work. So that's just one resource to start with. On the next slide, you'll see actually a framework, a tool that is highlighted in this resource. So this is another one of our probably most commonly used resources from our national center. And I wanted to share this with you today because school mental health systems can feel quite overwhelming in terms of where do we start, how do we make improvements, how do we even define what we mean by school mental health. So one of the things that our national center was charged with doing about 10 years ago now was developing a set of national performance standards for comprehensive school mental health systems. So basically, we were asked to answer the question, if we were doing school mental health really well, high quality school mental health in a school, in a district, what would that look like? How would we measure it? So we worked with a broad field, lots of experts, lots of folks with lived experience to say, here's what it would look like across a multi-tiered system of support. We put that onto a free online platform. We have about 20,000 schools at this point engaged with SHAPE, and anybody can be a user of SHAPE. So whether you're a parent, I'm a parent of 3 teens myself, so I can go in and actually enter in kind of my perspective on the quality of school mental health systems in their school district, for example. If you're a school administrator, if you're a state lead, there's also a state dashboard. So we have different levels of entry into the SHAPE system essentially, but it's a way of basically mapping out, there's a school mental health profile, kind of what's happening in my school or district with respect to services and staffing and data infrastructure. And then there's probably the most popular tool on the site is the quality assessment, where sites can go in, and actually on the next slide, I believe we have our domains of quality. Sites can go in and assess how are we doing in terms of our teaming. So that is, how are we teaming with families, students, communities to do a full array of supports and services for student mental health? How are we doing in terms of assessing our strengths and needs as a school mental health system and resource mapping what we have in our schools and community? How are we doing in terms of the full tiers of support? So tier 1, what are we doing to support mental health supports for all students? And then tiers 2 and 3, early intervention and treatment services. There's also a mental health screening module, an impact, what data are we using to assess the impact of school mental health? And how are we doing with respect to best practices in funding and sustainability? So this has been a resource that we hope has been really useful to a lot of individuals, districts, individuals, schools, districts, and states and territories as they are engaging with this. We also created an entity entry point because we have a lot of regional education centers across states now saying we want to take a look across the schools within our region, not specifically within a school district. So we have that as an opportunity as well in here. And everything on here, federally funded, it's at no cost to all users. There's also a lot of bells and whistles, screening and mental health assessment library, an organizational well-being assessment, a trauma responsive schools assessment. So I encourage you to check that out. And it's a good place to start if you're really trying to define what school mental health is in your system and how well you're doing. Next slide. Okay, one of the other things that a lot of districts have told us have been useful in their quality improvement journey in school mental health are these quality guides. So all of the domains I just mentioned are specific areas that a school district or a school building even may say, we want to start making some progress in this area. So let's say you do your quality assessment. Gosh, you're not doing that well in terms of mental health screening. It's an area you want to work on. Sometimes it's kind of hard to figure out where is it that you should start. So these quality guides actually walk you through, here's some action steps you can take, here's a strategic planning guide, here's some of the best tools that are out there. We are constantly updating these with kind of what are the best tools. So in our teaming quality guide, for example, there's the anatomy of an MOU between schools, a memorandum of understanding between schools and communities. There's example templates for how you can set up those memoranda of understanding. That's just one example. So helpful resource for you all on the SHAPE system. Okay, on the next slide. And I'm going to go ahead and drop those links again in the chat, only because I see that we've had a number of new folks enter in, so I want them to have access as well. So what you see here, those of you who are working in the education space, this will look familiar, but those of you who are not, you may recognize this as a public health triangle. When we talk about it in schools, we're often talking about a multi-tiered system of supports. So multi-tiered systems of supports are often how schools describe behavioral health supports and the levels of those in a school building or in a district. There are other frameworks that are used. It's modeled in some respects after a response to intervention framework that schools often use. Sometimes there's a lot of acronyms here. Sometimes districts are using PBIS, Positive Behavior Interventions and Supports, ISF, Interconnected Systems Framework, but MTSS is essentially the starting place from doing mental health or behavioral health supports in schools. We always talk about foundational elements of an MTSS being those true partnerships between families, schools, and communities to support mental health, and then professional development and support for a healthy workforce. So we can't really do tiers 1, 2, and 3 for students unless we start there with partnerships and supporting our school staff. And then tier 1, as you might guess, is what are we providing in schools for all students? Tier 2, what are we providing from those who are having more mild to moderate concerns? And tier 3, for students who may be struggling with more significant mental health challenges. So that's the language that we often use in schools. On the next slide, there's just a different way of illustrating it. There was a wonderful report that came out from the Judge Baker Center in Massachusetts, and they illustrated tiers of support in this way, using a school building illustration. What I really like about this is sometimes people talk about tiers as if you're a tier 2 student or a tier 3 student, and we really encourage folks not to talk about tiers as if it's the way to describe a student, but rather the level of intensity of support that's being provided. And one student may be receiving tier 1 and tier 3 supports at the same time, or even tier 1, 2, and 3 supports at the same time. And so it's just a matter of kind of the intensity of support. Sometimes we also hear schools saying, well, tier 2 are group interventions, tier 1 are individual, tier 3 are individual, tier 1 are for a whole classroom. Sometimes that might be the case, but you can have very effective tier 1, tier 2 brief interventions. So for example, you could have tier 2 brief individual motivational interviewing or problem solving interventions that are not group based, they're individual based. So just a different way of illustrating these tiers of support. Okay, on the next slide, I think just one more illustration of a tiered model of support. And I'm sharing this one. This actually came out also as part of the Baker Center report, but was modeled after a report that was done a couple of years earlier in the state of Connecticut in partnership with the Child Health Development Institute, or CHDI, in Connecticut, where they were really looking at kind of what do we have in place in our schools across the state? What examples do we have of specific interventions at each tier of support? And then on the other side of the triangle, you may be able to see there are examples of trauma-focused interventions at each tier of support. And if you're working in a school building or in a district, this is a nice way of kind of mapping out what do we have at each tier. But even at a state level, as you see here, as was done in Massachusetts and earlier than that in Connecticut, they really mapped out what do we have in the state and tried to figure out how can they systematize or have some universality around what we're offering so that they can really kind of centralize some of their technical assistance, training, and implementation support. And since a lot of you are in state leadership positions, I do want to really encourage you to be thinking from that perspective. We know that education is locally driven, but there's a lot that can happen even within a state Department of Education or other state partners to really offer training and technical assistance in some core practices that can be adopted more broadly across the state. And it can really help in terms of efficiency of funding. Okay, on the next slide. Right, so just to go into a little bit of detail, I know I mentioned the tiers of support. We do think in triangles when we're talking about school mental health. And I just want to give you some examples of probably the most common and what we would recommend be in schools at each tier of support. So at tier 1, and if you look in our school mental health quality assessment, you'll see us ask about this, about each of these different types of interventions. So we would recommend that all schools have not only an assessment of school climate, but also interventions that promote positive school climate. We're seeing a lot these days, given the recent CDC report that took a look at the rates of mental health challenges in young people. One of the strongest recommendations they came out with is interventions that promote connection and belonging in schools. That falls under the school climate umbrella. So school climate is a critical tier 1 service and support. Teacher and school staff well-being, often neglected. There's a lot more attention to it these days, especially given the attrition of teachers from the field. This is essential. There's been some fantastic work done actually looking at the correlation between educator mental health and student mental health. Not surprisingly, there's a link there, and we need to be taking care of our educators as part of our effort also to take care of our students. Positive behaviors and relationships, there's been a lot of work done in this space from PBIS, from nurturing environments work, interventions like good behavior game that promote positive behaviors in support in the classroom. Positive discipline practices, we've seen a lot in this space under restorative practices. We know it's tied to both positive mental health and academic outcomes for students. And then 2 areas that we're seeing real positive momentum in terms of state legislation, mental health literacy. And what I mean by this is really infusing K through 12 education, mental health literacy for students. We know mental health literacy for educators is also important, but really building it more fully into the curriculum so you don't just get 1 hour of mental health in 9th grade or mental health in 9th grade health class, for example, that it's really something students are learning about from K or even pre-K all the way through. And what we mean by mental health literacy is really learning not just how to identify signs of mental illness, that's an important part of it, but also how to promote positive mental health, how to build those coping skills. Social emotional learning, it's been in the news a lot lately. We would argue that it's absolutely essential, again, pre-K through 12, as a way for our young people to bolster their coping skills, their ability to be resilient in the face of adversity. And these are some of the tier 1 supports that we see in thriving schools that really have that full continuum of school mental health. So on the next slide, you can see the definition we use for tier 2 strategies. So I mentioned when we're talking about tier 2, we're really talking about the level of intensity of supports that are provided. And we think about these tier 2 supports as those that are supporting students that may be experiencing mild distress or functional impairment, or maybe be at risk for a given problem or concern. What this looks like in practice, as I mentioned, it can be individual based, it can be brief interventions, it can be interventions based on core cognitive behavioral, motivational interviewing, or problem solving skills. It can also be group interventions that we see in school buildings. Why is this important? On the next slide. We often talk about the missing tier 2. So it's one of the things that when I'm talking with state leaders and funders and insurers and Medicaid officers, we are in constant discussion these days about how can we build out our tier 2, because often we're defaulting to tier 3, longer term, more intensive treatment. Not every young person needs treatment. And if we move upstream with early identification intervention, we're going to do a lot in terms of preventing crisis, preventing downstream needs, right? We know that mental health problems often first emerge at school or during those elementary and secondary school levels. And we know that when we identify and intervene early, that we can prevent the worsening of symptoms and that it can promote positive youth development. So lots of good reasons to be doing tier 2 interventions in addition to tier 3 interventions in schools. And schools really are the optimal place to be providing these supports. Next slide. So tier 3, why do we need to be providing mental health supports in schools for students with significant distress or functional impairment? Well, we know, and the next slide will illustrate, that many more young people who receive supports receive them actually in schools. Schools are an accessible place for many young people and families, not all, but for many young people and families to receive care. And that's not to say that we're doing so in isolation from the community mental health supports at tier 3. We know there needs to be a seamless coordination between community mental health and school mental health, but lots and lots of young people will not receive their mental health care if it's not offered in the school setting. And we know, based on years now of studies, that when we do provide mental health supports in schools, it is effective not only at reducing symptoms, but also at improving the academic outcomes, including rates of chronic absenteeism, for example, for young people. On the next slide, you'll see an illustration here of one of the statistics that we're hearing quite often these days. Young people are 6 times more likely to complete mental health treatment in schools than in community settings. This statement actually comes from a study that was done post-Hurricanes Katrina and Rita, where they randomized young people to receive mental health supports for trauma, a trauma-based, evidence-based trauma intervention in schools versus in the community. And they had a far higher rate of not only initiation of treatment, but also successful completion of treatment when it was offered in the schools. And I can tell you, having worked as a clinician in schools for many years, my no-show rate is much higher, as is the case for all community mental health, than it is in the schools. Young people, for the most part, are in school buildings. They're more accessible. So it's not surprising to me that the rates of initiation are higher, and young people do tend to stay in treatment longer when it's offered in the school building. So it's essential to be offering these services right there in the schools. We're seeing a lot more community partnerships now doing this successfully. Next slide. So I know that some of the discussion today will be focused around kind of that tier 3. So how are we supporting our students with the most significant mental health, behavioral health concerns, often referred to as severe mental illness or SED in the school environment, serious emotional disability or disturbance, depending on the language that states are using. And I want to just really emphasize that there's kind of a fallacy, I think, that, once young people reach a certain level of need, that schools are no longer a part of the equation. And I would say that couldn't be farther from the truth. We certainly want to layer on and integrate other community-based services. That's essential, but schools remain a critical partner in that system of care, even for our young people with the most significant needs. The resource that you see here is actually something we did in partnership with NASHBID, the National Association for State Mental Health Program Directors, when we were looking at how can schools be a supportive entity in the care of students with early psychosis. And so we went through all the things you see here in terms of the critical role of schools in supporting mental health literacy, early identification, creating natural referral pathways and follow through, support for students and families, and education for peers, school-based modifications, reducing stigma, and promoting hope and supporting recovery. So just one example of a resource that really speaks to how essential schools are at that higher level of service need. Next slide. So one thing that we want to emphasize, the question today is kind of how are systems of care integrating schools into the work. And one thing we always talk about is it's not either or when it comes to who's providing the services, school employed versus community employed, it's both and. This is a resource also linked in what I shared earlier in the chat box, We put this out from our national center with the National Association of School Psychologists. And on the next slide, you'll see the illustration here with the double triangle, a little bit bigger. This just demonstrates that in schools that have effective community partnerships with, for example, with an FQHC, school-based health center, a community mental health center, coming into the school to do support services, often what that looks like is the community mental health partner or the federally qualified health center coming in and providing more of those tier 3 services, whereas the school employed folks, whether it's your educators or your school counselors or your school psychologists and social workers, they're often providing the bulk of your tier 1, and then tier 2 lies somewhere in the middle. And this is very tailored to the resources and the needs in each different school and school district, but just an example of what this could look like in a district. Next slide. And I'm just going to close with a resource. Again, I know many of you are working at the state level and really working to advance school mental health within your state. Sometimes it feels like it's hard to know where to begin. We've been partnering with a group called Inseparable, who's been spearheading what's called the Hopeful Futures campaign. If you haven't learned of this yet, I'd encourage you to check it out. They have 2 resources that I think have been instrumental in really changing the policy landscape for school mental health over the past couple of years. One is this school mental health report card, where they essentially rate every school based on, every state based on data on 8 key areas of school mental health quality, including staffing ratios, financing, digging down into how well they're leveraging Medicaid, for example. And the second resource that I think is just a gold mine for state leaders is the legislative guide, which again goes in each of these domain areas and highlights promising states and legislation and links to specific legislative language and successful legislation to advance all of these areas in schools. So we're really excited to see this happening and to see somebody really kind of culling through all the data and the legislation that's happening and putting it into one place. So I encourage you to check this out. And I think with that, I have a final contact us slide, and I will then go ahead and pass it on to our partners in North Carolina to share all of the good work that they're doing. Thank you so much.
Good afternoon and welcome. It's great to be with you all and share a little bit about what's happening in North Carolina and just some of the work that we're doing and how we've used our partnerships and our data to move some of this mental health work forward in our state. Next slide. So everything we do here, we do within the context of the whole school, whole community, whole child framework. And that allows us to make sure that we're coordinating our services, whether they're between agencies or within schools and organizations. But all of that work we ground in the community in which our districts live and work and play, so that all their work supports the folks locally, as well as we provide resources and support from the state. Next slide. Also, what's really important to note is that we use data to drive all our work, whether that's the youth risk behavior survey data or other school health profiles data or absenteeism data. We take that data, which then leads us to determining what programs and actions we want to take, and then what policies, or sometimes the policy is developed first and then the programs come out of that. So always using that data to drive our work. Next slide. And the data that we use most often when we're talking about student level mental health behavior is our youth risk behavior survey data. And we use that primarily because it is what our students tell us they need. That student voice is definitely the road to change. And so our data comes directly from our students. Next slide. And just a few examples of the data in North Carolina to show what set the stage for why we needed to do the work that we've been doing with our partners. If you look at the percentage of high school students who say they feel good about themselves, that has dropped from 80% in 2011, and all of this data is over 10 years, I might add, to 49% in 2021, with a very significant drop from 2019. So again, very important data to tell us that we need to target our interventions. Next slide. We also looked at the percentage of high school students that agree that they feel alone in their lives, and that has increased since 2019. A little bit of an increase along the way, but a more significant increase from 2017 to 2021. Next slide. And this is a real important slide for us. One of the things that we noted is that the percentage of students who felt sad or hopeless, and that question has a lot more to it, felt so sad or hopeless that they stopped doing their regular activities each week. That has decreased. More and more students are feeling sad and hopeless, I guess is what I'm saying in terms of the direction of that, or increased. But what we also saw at the same time was that the percentage of students who were physically active decreased. So the students who felt more sad and hopeless increased. Let me clarify there. I think I misspoke. And those who felt were not physically active, those who were physically active decreased. So we saw that, we've always told when you're dealing with depression, you're dealing with emotional issues, we know that exercise does have a positive effect, and yet we've seen exercise go down and mental health issues go up. Next slide. We also looked at our suicidal behaviors across our students, and these are high school students in North Carolina from 2015 to 2021. And each year, you see the blue there, is seriously considered attempting suicide in the past 12 months. And each year that has increased up to 22% in 2021. We also saw an increase in those students who made a plan for attempting suicide in the last 12 months, and that increased as well. Those who attempted suicide stayed about the same over that time, but that's still a problem if we have 10% of our students who are attempting suicide. So again, very alarming numbers for us here in North Carolina. Next slide. We also broke that data out by our students who identify as gay, lesbian, or bisexual. And just for clarity, that's the question on the Youth Risk Behavior Survey. We asked students to identify themselves. We do not at this point ask them if they're transgender, so these are just, but we can assume that these numbers would be very similar to our transgender students. But if you look at that, our heterosexual students, 15% seriously considered attempting suicide, but 48% of our gay, lesbian, and bisexual students did. So clearly, again, much higher for those students in terms of risk factors. Next slide. The other issue that we noticed this year that had really been pretty significant is how some of these issues are impacted in our female students. If you look at our male students and who seriously considered attempting suicide, that's stayed about the same over the last 10 years. But if you look at our female students, that's gone from 15% to 30%. So again, it gave us a very specific target in terms of some of the prevention efforts that we really need to be doing, and we will continue to do in North Carolina. Next slide. We also asked students, those who, if they felt safe on their way to school, on their way home from school, or at school. And this has been very surprising to us too, is that since 2015, it first started gradually going up, but we've continued to have significant increases since 2017 in the students who don't feel safe on their way to school, at school, or at home. And I will say the question, we can't tease out which one of those, whether it's on the way to school, on the way home from school, or while they're at school, but we do know that many of our students are not feeling safe. And I will also say that in 2021, this number was pushed up significantly by our LGB students who didn't feel safe going to school. Next slide. We also asked that question of our middle school students, and we've seen the same kinds of trends happening as well. But this is our gay, lesbian, and bisexual students. You can see that slide. It shows how that increased significantly among those students, and that pushed up our overall number. Next slide. This is a slide that really, this information really alarmed us this year. We looked at the percentage of students who have been experienced dating violence, physical dating violence. And that's always been about the same, gone down, but this year from 2019 to 2021, that jumped from 7% to 13%. again, really alarming and something that tells us we really need to do some targeted prevention efforts and intervention efforts with those students. Next slide. So one of the things that we've done to address some of that is through a school-based mental health policy. And this is a policy that was passed by our General Assembly, passed by our State Board of Education. It also comes out of our General Assembly in terms of session law that tells us that every school district needs to have a school-based mental health policy. And that policy needs to include several components: data and assessments and evaluations. It needs to have, every school district has to have an intervention and suicide risk protocol. They need a training plan for delivering training to their district personnel. They need a building infrastructure for addressing those issues. And then we look at their needs moving forward so that we can help support them in that. Next slide. So we looked at what some of our districts said they needed based on that policy. And we have collected data for 2 years now on the policy. We're going into our 3rd year of data collection. But our districts were really clear on what they needed. They told us they needed a more comprehensive training on the policy and legislative topics. And they need funding, which we will always be advocating for more funding and hoping for more funding. They had said they needed additional permanent school counselors, school social workers, and nurses in our districts. And, you know, a lot of folks got money during COVID and they were able to add some temporary positions, but those somewhat inflated our numbers, and now they're falling back to our ratios not being as good as we had hoped. They need systems for tracking interventions, and we'll talk about one of those in a few minutes. Hanaleah will talk more about that. They need assistance with MOUs. They have to have an MOU with an LME or MCO in their community. They need more providers, which is no surprise to anyone, I'm sure. They need stronger parent engagement, and they want resources for substance abuse and teen dating violence. And many of these we'll be addressing through a collaboration that Hanaleah will talk about in just a minute with our school behavioral health action plan. Next slide. So just a little, well, I'll turn this over to Hanaleah because I think that they actually started this collaboration.
Thanks, Ellen. So yeah, so as y'all can see, Ellen and I are presenting together because this has really been an essential collaboration between the Department of Health and Human Services and the Department of Public Instruction. But we couldn't have done this without the support of ASTHO. You know, this was really kicked off when we were selected as one of 5 states to work with ASTHO on a school mental health strategy. And our plan really came out of that collaboration. Next slide. So this is a list of just some of the stakeholders that were a part of this plan. This was really an effort to engage community members, content area experts, providers, teachers, and people across the department, both in DHHS and the Department of Public Instruction, in order to create something that really reflected the top priorities that folks were communicating to us around school mental health. Next slide. So this slide really highlights to you some of the initiatives that came out of our action plan and where they fit within kind of our conceptualization of the different points of intersection in order to influence school mental health. So of course, at our core area, we recognized that we needed to provide additional support to our school mental health workforce. Our action plan does recognize the need for additional staffing above everything else. It also incorporates a number of initiatives in order to strengthen the workforce. And this, this model really came out of work that we did during COVID in order to use CDC funding that we got during COVID in order to rapidly deploy support to our school staff and to our schools in general. So what you see here on the left is the various initiatives that we rolled out with our CDC funding. So everything from putting trainees in schools to providing additional training and technical assistance so that school staff can recognize mental health challenges and know how to respond. Moving on up, we provided additional funding for local programs and really tried to link those programs with our schools. Again, expanding out to helping schools better connect with the resources that are already available in their communities. So one of the core things that we did was we trained schools in how to better link up with their systems of care to address the needs of students. And we also did several media campaigns focused on increasing awareness of 988 as a crisis resource, and then also trying to reduce stigma among traditionally marginalized populations of youth and their families in order to help them take that step to access care. We, moving again on up, we worked around that culture and belief around mental health care. You know, that's some of where that anti-stigma work comes in, but we also did more of that infrastructure work. So thinking about data linkages to really think about what are the needs going forward and look at what we're already doing and what we could be doing. And one of the most essential strategies that we did during this time was to use our funding to build a statewide school electronic health record system so that student health records will move with them from school to school and to make it easier for schools to bill for the services they provide. The initiatives that you see in yellow bridge across both our COVID funding initiatives and the School Behavioral Health Action Plan. So we folded those initiatives into the action plan so that that work can continue and expand moving forward. Next slide. So this is the final action plan. You can find it online at the link that's shown here. It was published in March of 2023, and it lays out these 6 essential strategies that we think are like the essential first steps to strengthening school behavioral health in our state. I went over a few of these as they related to our COVID initiatives. I'll highlight some that I didn't talk about. So one of the things we heard was that our rural communities and our really under-resourced communities needed more telehealth in schools, specifically for behavioral health services. And what we found was that there was actually pretty good coverage starting to happen around physical health services, but behavioral health services via telehealth in schools was really lagging behind. So one of our strategies focused on a pilot that would really expand those telebehavioral health services into highest need communities. We also focused on supporting continuation of the initiatives that were created during our Project Aware, Project Activate first cohort grant. So this, really relies on that multi-system level of supports. And our goal here is to make this a self-sustaining group of initiatives for these districts. And we just need some additional time to do that. And then I think I mentioned our school linkages. I don't think I actually mentioned our School Health Advisory Council support, which is actually something that was started during COVID. This was all about funding those local groups of parents and teachers and staff and community members in what they deemed most important to their local districts in order to support behavioral health. And then finally, we've been rolling out mental health first aid using funding we received from the governor in order to just create that basic level of knowledge and skills needed to respond to a mental health need in a student. Next slide. I'll turn it over to Ellen to close us out.
All that to say that we've done quite a bit of work. We're still continuing that work, and so much of that work comes because of partnerships that have been built many years before. And so it put us all in the right place at the right time to continue those partnerships. And we're real excited about a lot of those strategies and a lot of that work that Hanaleah just mentioned. The idea that we could have an electronic health record system that followed students from one district to the next is really exciting. And we're working on that right now as we speak, because the bottom line is that we know that healthy children learn better and they live better. Next slide. I think that was.
Great. Thank you so much to all of our presenters. we're now going to take some time, about 15 minutes for Q&A. And while you're all putting questions in the chat, I'll start off just a couple. I'll start with Sharon. So from your vantage point and working at the kind of education behavioral health space, how would you recommend that our participants start engaging with schools? We have a lot of attendees that either work in public health or at NAMI. So we'd love to hear a little bit more what recommendations you have for engaging with schools.
Yeah, it's a great question, Ioana. And it's funny, we often hear from schools, we don't know how to partner with our advocacy community or with our health and behavioral health partners. We hear from our health and behavioral health partners, we don't know how to get in the door of schools. And there certainly are some walls built up, and there's some healthy skepticism, I think, from the education sector at times, because they have lots of folks kind of knocking on their doors, especially, and I see Ellen smiling there, she's familiar with this, especially when they hear that, gosh, there's all this funding coming down the pipe to states and local education agencies that can fund mental health. And so there's a lot of vendors that are coming. Okay, so that's kind of the landscape right now, that, how do we talk to each other and how can you form trusting and meaningful partnerships? Where we've seen this done well is often when we have coalitions or communities or, even children's cabinet within a local community or at a state level, where the child serving agencies come together and talk about kind of the different strengths and needs of their services, who's funding what. Often it comes down to funding. And then just looking at some examples of how other communities have engaged, how other communities have had school districts engage community partners. So, but I think your question was really, if you're at a community health or behavioral health partner, or at the state level or at the district level, how can you approach schools? Often it is starting with the leadership in districts or perhaps a school board, and talking with them about the value. The advocacy community, NAMI certainly has spearheaded a lot of these conversations, really saying why we need to do this work in schools. I'll put a link in the chat. We came up with a few advocacy tools for how you take those first steps to have conversations with your state and local schools. And sometimes it's through the school board, sometimes it's just sitting down with your district leadership, whether it's your director of student supports, to say that we have mental health supports in the community, we can offer mental health supports, but really asking the schools, what is it that you need? And saying that you want to augment and seamlessly intertwine with what they have existing already, because there's a lot of very well-intended community partners that want to kind of come and set up shop in schools, not recognizing the primary mission of schools and kind of how the schools work and what they're, what they're measured on, what they're assessed on. So a lot of conversations need to happen. Our teaming quality guide gets at this, but I'd love to hear from our North Carolina partners also.
I would always start with make the friend before you make the ask. And that's, going to schools, volunteering in schools, being engaged in the community and knowing what they have going on and what's unique to them. Schools often get brought a lot of programs and products that won't exactly work because of who lives there. And I don't mean that in a bad way, just because there's different communities. And so really spending time in the community with people, and making that friend. And I think that would be my first and best advice to anybody who wants to get into a school, because we hear that a lot. How can I get into the schools? And I'm like, go volunteer, go to your child's school if you've got a child in school, and see what they do in school on a daily basis and how hectic it is and what the day looks like. And maybe you all know that, so I'm not minimizing how much people on this webinar already know, but I do think that's a real important part of getting that trust built that you need in order to really deliver good programs in communities and schools.
Wonderful. And I have one more questions and then we'll turn it over to the questions in the chat. We've talked a lot about strategies, different strategies across tiers, data that states can kind of take in order to improve youth mental health. If you had a recommendation for what to focus on as the first building block, what would it be and why?
That's a hard one. We know that what to focus on first and why will vary so much even from school to school, certainly district to district, and even state to state. I think if you had kind of a universal what to focus on, it would be do a landscape analysis of what you have and what you need. Where are your strengths and needs? The school mental health quality assessment I mentioned often is a springboard for that conversation, because it basically walks a team, and it can be a team of 2, it can be a team of 100. It has everybody assess kind of where are we on these 7 key areas of school mental health, and it gives you, it spits out a report that says, here's where we're doing well, here's what we have, here's where we're lacking, and it can kind of help shape where you might want to start. But some school districts will say we need to start with school mental health screening. Some will say we really want to build up more of a robust tier 1 before we start tackling tier 3. So where a school district starts really depends on what they have, where the momentum is, low-hanging fruit, funding. There's so many factors that go into that.
Yeah, I mean, I would say there is not one size fits all. The most important thing is to listen to the stakeholders, to the previous question about what they need most. I think that was why our local funding initiative was so powerful as a first step, because it allowed us to let them decide what they wanted to do first. So if you only had a small amount of money, you might consider something that really empowers local districts to, self-prioritize with some support.
Wonderful. Thank you all so much. So the first question from the chat is about the North Carolina statewide school electronic health record. Can you tell us a bit about how far along in that process you are, what data points are going to be included, and how it interfaces with medical health records?
Sure, I'm happy to give you a little bit of that. We are working tirelessly to finish and have it ready for the next school year, partly because that's when the funding ends and we have to have it done. So that always helps motivate. Actually, our health records that our school nurses collect have always been there. Obviously, there's data they have to collect, but many districts, some use electronic health record systems that are purchased for their district. Some use pencil and paper. Some use spreadsheets that they've created on their own computers. And so the goal was to try to bring something together that everybody could use, and that also transferred from one district to the next. And in addition to that, something where we could put mental and emotional health, behavioral health records as well, so that we could follow those students. Because one of the things that we found is that, a lot of times students move from one district to the next, and we don't have that information on them for a period of time until they get settled. And so we don't know, for example, if there's a protective order against a child's parent, one of their parents. We don't know that when they move to the next district until there's some time has lapsed, and sometimes that causes problems. And so that was probably the biggest success of this, is that we've gotten the permission to move these health records with a student when they move immediately. Most of our districts use PowerSchool, and so we were able to take the PowerSchool health module and customize it with more of what we need for our nurses and some of what we need. And I'll admit, this is the early stages of what we need for our behavioral health records, with the ultimate goal that we'll also have all the data needed if schools want to bill for those services as well. So we're still working on it. The customizations are being done right now, and there's a plan in place for a training rollout for everybody who'll be using it. The first couple years will be a lot of trial and error. There'll be a lot of selling the product and getting people to use it, because we don't have legislation that requires that people use the product yet. But continuing to work on that product so that we can get something that we follow students immediately, and we have the information we need in a place where everybody can access it. So right now, the mental health records are inside of the school health record. And again, those are FERPA records. So those are education records. They're not health records, so they don't talk to local health systems. I'm not sure if that's enough or if that's too much, but.
Thank you, Ellen. And just to follow up around the privacy, how are you ensuring the privacy of students and working with stakeholders and families that might be concerned about that aspect?
So that's something we've always had to deal with in general, but we've been using PowerSchool in our state for quite some time. or a student information system, that even if it's not PowerSchool, that has all the privacy built in. And it's the same, and nurses have already been able to use this system. So obviously there would only be certain users that can use the information. No data is given out unless it's an aggregate. And the only people that can see each student are those students who are those personnel who would have access to that student record anyway. So not just any teacher, for example, in PowerSchool has access to the health records. Only the school nurse and the other mental health providers that would have a need for that access. The student information system has become such a regularly used system in North Carolina that I think the confidentiality for the most part has not been a huge challenge at this point. And I'll just add that if people are keeping records in a file cabinet somewhere on paper and pencil, those are also not very secure. This is a much more secure method of keeping up with that data because we can lock the data and only data folks have that access.
Great, thank you. And we have time for one more question. And this came from Janet. We talked a little bit about this. How are you engaging at the local level, and that local districts are getting a lot of information from a lot of areas. So how can we really take the research and evidence base and kind of make it through all of that noise and make sure that they are getting the right programming that they need? And so if you have any recommendations for how to engage in research-based practices, I'd appreciate it.
The one thing I'll say there is there's actually been some interesting research looking at how school leaders make decisions about the programs and practices that they adopt. And it's often not what we would wish, right, based on the science or the merit of the interventions, but on what they learn from their neighboring district, or even something that was just marketed or packaged very well. Those are kind of the two things that stand out. And so we need to both leverage the fact that relationships matter, that if they have a superintendent in a neighboring county that is using something, they're more likely to use it. So we need to leverage that by fostering communities of school leaders to share best practices with each other. And that can state leaders have a big role in doing that. They can establish kind of cross-district learning communities where they're sharing best practices across district leaders. But also we know that, you know, the things that come in the shiniest packages are not always the most effective. And so having entities, and they can be state level entities that kind of weed through some of the, you know, kind of what's being sold out there versus what the science says. So those are often known as like purveyors or intermediary organizations. In Connecticut, I mentioned one already. They have CHDI, who really serves as the purveyor of best practices. And the state, the Department of Children and Families, Department of Education, really partner with CHDI to say, what is the science telling us? And then what are the best practices that we should be disseminating across the state? So that we need knowledge translators. One of my favorite kind of purveyors that does this work for school mental health is School Mental Health Ontario. They're up in Canada, but we could learn a whole lot from them because their Ministry of Education basically relies on them to help distill down the knowledge to across the province to the school districts and helps them with that decision making. So I'll stop there.
I'd love to hear if Ellen or Hanaleah, you have anything to add.
Yeah, the other thing I'll add is just, you know, when we were looking around, again, we were not doing a whole strategic plan. We were looking for low-hanging fruit. There are already a lot of evidence-based initiatives that have some level, you know, of footprint in North Carolina. And so we were really able to leverage, both with our COVID funding and our plan, let's build on the initiatives that are already here that we know have evidence, whether that's Project Aware, whether that's systems of care, and expand on them rather than trying to start something new. I think it's always like, you always want to start something new because it's exciting and fun, but often you can get the most impact for expanding that thing that's already out there and that has that evidence base.
Great, thank you all so much. And I know we're almost at time. So I just would like for you all to complete the evaluation. And if you're interested in the webinar series, we'll follow up with the next two so that you are able to attend those as well on pediatrics as well as nonprofits role. Thank you all so much for today. And I'll turn it over to Kelly to see if she has any final thoughts.
Thank you, Ioana, and thank you so much to our presenters today. Thank you for spending the time to share that important information. And as Ioana mentioned, please take time to fill out the evaluation at the end of this when we close out. And again, thank you, SAMHSA, for allowing us to share this information with you. Enjoy the rest of your afternoon. Thank you. Bye-bye.